This is the Coronavirus Morning Report for Wednesday, April 29th, 2020. I'm Brian McCullough. We have the first scientific study to show that maybe aerosolization of the disease is possible, considering the psychological toll of the disease on society, not just the medical toll. Hard numbers on how much testing and tracing individual communities will need to reopen with confidence. Is blood sugar another key corona factor? And could a new antiviral coating be a game changer for public spaces? Very bad news this morning. First, just a milestone. The U.S. infection rate has officially passed 1 million people. And then this. A study has found that the coronavirus might exist in tiny airborne droplets. This was found in a Chinese hospital, marking the first real-world data to suggest that airborne transmission of the disease might be possible. Such aerosolization has been previously demonstrated in the lab, but new droplets with genetic markers of the virus were also detected in hospitals in Wuhan, China. This was published in the journal Nature, quoting from the New York Times. It remains unknown if the virus in the samples they collected was infectious, but droplets that small, which are expelled by breathing and talking, can remain aloft and be inhaled by others. Those are going to stay in the air floating around for at least 2 hours, said Lindsay Marr, a professor of civil and environmental engineering at Virginia Tech, who was not involved with the Nature paper. Quote, "It strongly suggests that there is potential for airborne transmission," end quote. Dr. Marr and many other scientists say evidence is mounting that the coronavirus is being spread by tiny droplets known as aerosols. The World Health Organization has so far downplayed that possibility, saying that the disease is mostly transmitted through larger droplets that do not remain airborne for long or through the touching of contaminated surfaces. Even with these new findings, the issue is not settled. Although the coronavirus RNA, the genetic blueprint of the virus, was present in the aerosols tested, scientists do not know yet whether the virus remains infectious or whether the tests just detected harmless virus fragments, end quote. Quick check-in with a country that seems to have handled the outbreak well, but we haven't mentioned it in a while. Quoting from The Guardian, Vietnam has now gone 5 days straight without reporting any new confirmed cases of coronavirus and nearly 2 weeks without any domestic transmission, with its prime minister saying on Tuesday that his country had, quote, basically put the pandemic under control, end quote. By Wednesday, Vietnam had recorded a total of just 270 cases, of whom 222 had been announced to have recovered, and 0 deaths. However, of those who still had active coronavirus infections, 11 had already tested negative at least once before relapsing, Chow Hanoi reported. According to the news site, Vietnam had conducted more than 210,000 coronavirus tests without recording any domestic transmission for 13 days, end quote. And a check-in with an early hotspot country. 325 people died in Spain over the last day, pushing that country's death toll above 24,000. This is the 6th consecutive day that deaths in Spain have been below 400. And the number of recovered cases in that country is now 108,000. Spain has the second highest number of confirmed cases in the world, with 212,000. Finally, with all of the antibody testing rolling in, controversial as it may be, I did want to take the time to point out what running the numbers on that data shows. I'm going to quote from the Washington Post, and do note that the 10x rule of thumb might still be holding up here. Quote, "The new serological data, which is provisional, suggests that coronavirus infections greatly outnumber confirmed COVID-19 cases, potentially by a factor of 10 or more. Many people experience mild symptoms or none at all and never get the standard diagnostic test with a swab up the nose, so they're missed in the official COVID-19 case counts. The crude case fatality rates covering people who have a COVID-19 diagnosis have been in the 6% range globally as well as in the United States. But when all the serological data is compiled and analyzed, the fatality rate among people who have been infected could be less than 1%. But as infectious disease experts point out, even a seemingly low rate can translate to a shockingly large death toll if the virus spreads through a major portion of the population. Epidemiologists have said somewhere between 40 and 70% of the population will likely become infected in the next couple of years if there is no vaccine and the public does not take aggressive measures to limit the spread of the virus. Do the math. said Jeffrey Shaman, a Columbia University epidemiologist who has been studying the coronavirus since early in the outbreak. Shaman and his colleagues have developed a model of the coronavirus spread that estimates that only 1 in 12 infections in the United States have been documented in official counts. That leads to an infection fatality rate of 0.6%, he said, a figure that roughly matches what has been seen in New York City. At that rate, the United States could potentially experience 1 million deaths if half the population became infected and no efforts were made to limit the contagion through social distancing, a vaccine, or proven therapeutics, Shaman said. That's 20 times worse than a bad flu season, he said Monday, end quote. If you've been having trouble sleeping, or perhaps you've been feeling a tight chest and shortness of breath and become concerned you might have COVID-19 despite lacking any other symptoms, you're not alone. In a sense, all of us are going through trauma from COVID-19, whether or not we pick up the disease. Physician Lucy McBride and UC Irving social psychology professor Roxanne Cohen-Silver wrote yesterday for the Huffington Post about why many of us are experiencing such symptoms and how to cope with them, as well as with the COVID-19 crisis overall. Quoting the Huffington Post, "We are experiencing collective trauma unlike anything previously experienced in America in our lifetimes. It is devastating to our individual and shared well-being. The virus's invisibility, asymptomatic spread, and ubiquity are uniquely terrorizing. The absence of safe spaces, the possibility of another mass outbreak, and the tragic realities broadcast into our living rooms every day promote further fear. And just when we need our normal coping strategies like exercise, sports, and congregating with friends to manage stress and loss, they are severely constrained for our own and others' good. But naming this disaster as a collective trauma helps introduce a set of specific recommendations for coping now and for the long haul," end quote. First and foremost, the experts in the piece emphasize that mental health and physical health are inextricably tied together. Addressing mental health concerns is not just a bougie luxury, it's essential for treating patients' overall health. Having fight or flight reactions like sleeplessness, shortness of breath, chest tightening, and feeling constantly on edge are normal reactions to the trauma of this time, McBride and Silver say, but there are coping mechanisms that can be implemented. They suggest limiting media exposure, practicing breathing exercises through yoga or meditation, and having standing check-ins with other people, whether that's a virtual happy hour with friends or a formal support group. For those who feel too overwhelmed, the help of a professional is recommended, especially because, as these two doctors point out, quote, "The trauma will persist even if we're able to resume some sort of normalcy. Large-scale crises like the COVID-19 pandemic have lasting effects, particularly when trauma is repeated and prolonged. The emotional, physical, and behavioral ramifications of PTSD have been well studied. In the aftermath of SARS in Hong Kong, for example, nearly 2/3 of survey respondents expressed helplessness, and nearly half reported moderate or severely deteriorated mental health," end quote. And those mental and emotional symptoms coincide with physical symptoms as well. For example, quoting again, "Patients who have experienced adverse childhood events are at significantly higher risk for developing subsequent health problems like obesity, diabetes, and heart disease. Individuals who were acutely stressed by watching the 9/11 attacks and their aftermath on TV were more likely to develop heart problems over the ensuing 3 years," end quote. While that probably sounds pretty daunting, the doctors point out that decades of research on trauma has one thing in common: the resiliency of humans. People often find meaning in adversity and discover strengths they never knew they had. The knowledge that we're all in this together and the need to look out for one another can fend off feelings of isolation. While none of that is a silver lining, the two doctors say it can help make sense of the crisis. A new Harvard study says more than half of U.S. states will have to dramatically increase their coronavirus testing capabilities in order to safely start to reopen their economies over the coming weeks. Quoting from Stat, "The analysis shows that as the U.S. tries to move beyond its months-long coronavirus testing debacle, faulty tests, shortages of tests, and guidelines that excluded many people who should have been tested to mitigate the outbreak, it is at risk of fumbling the next challenge, testing enough people to determine which cities and states can safely reopen and stay open. Doing so will require the ability to catch reappearances of the coronavirus before it again spreads uncontrolled," end quote. The Harvard team analyzed the testing requirements not only by a state's population, but also by the size of the state's COVID-19 outbreak. Setting May 1st as a target date, the team worked out how many tests per day a state would need to run in order to safely reopen. STAT then compared these numbers to each state's daily testing totals as reported in mid-April, revealing that 31 states and the District of Columbia need to ramp up, in some cases by huge amounts, in order to catch outbreaks before they flare into hotspots and spread widely. New York, for example, needs to run an additional 109,000 tests per day over its current capacity. New Jersey, more than 68,000 additional per day. Georgia, which is already starting to reopen, would need an additional 5,300 tests per day, with Florida needing an additional 5,200. Quoting again from STAT, in the last week, the U.S. as a whole conducted 1.6 million tests, according to the COVID tracking project. The Harvard team says twice that many tests will be needed at a minimum. Performing enough tests is only one of the essential steps before states can reopen, experts say. Test results also have to be returned more quickly. Public health workers must identify and contact potentially exposed people, and hospitals and nursing homes require adequate amounts of personal protective equipment and other supplies in case a new wave of seriously ill patients crashes over them, end quote. Which brings us to contact tracing, a subject we visit often. An essential partner to testing, in which public health workers figure out who an infected person has been in contact with so they can self-isolate and reduce the spread of the disease. Contact tracing goes hand in glove with actual testing. As we covered yesterday, a bipartisan group of public health experts has called on Congress and the White House to invest $12 billion in recruiting and paying for a contact tracing workforce of around 180,000 people. But where do we stand currently? Well, we're a ways off. An NPR analysis found that across 41 states and D.C., there are just over 7,300 contact tracers on staff now, with plans to surge to just over 35,000. And keep in mind that this study suggests that we need a total of 180,000. Quoting from NPR, the raw numbers each state needs vary by population size, the number of positive cases, and whether measures like social distancing have effectively limited the contacts for each case. Former CDC Director Tom Frieden says. According to the National Association of County and City Health Officials, which recently issued a position statement on contact tracing, 15 health workers per 100,000 people is a baseline number during normal times, and during a pandemic, this number should double to 30 people per 100,000 people. The average rate of contact tracers among the states we had data from was 12 per 100,000 people, so a little less than half the numbers needed, just shy of the estimated need during normal times and a third of what is projected to be needed during the coronavirus pandemic. The median was even fewer, 7 contact tracers per 100,000, end quote. Just 3 states, Michigan, Nebraska, and North Dakota, plus the District of Columbia, are poised to meet or exceed the 30 workers per 100,000 people threshold. It's clear that the federal government needs to step in with investment and training to get a national contact tracing infrastructure up to speed in time for reopening this summer. Crystal Watson, a senior scholar at the Johns Hopkins Center for Health Security, told NPR, "This is unprecedented. This is not something we've done before as a nation. It may be hard for some states to even think about how they get started on this, so guidance from the federal level is definitely needed," end quote. Keeping an eye on what factors may cause the most severe reactions to COVID-19, as seemingly every day we're learning new things that this disease does to our bodies. According to a study published last week in Science Advances, blood sugar may be a key trigger for the cytokine storm that has been pushing many patients to the brink of death. To back up, a cytokine storm, quoting Scientific American, is, quote, a surge in cell signaling proteins that prompt inflammation that hits the lungs, attacking tissues and potentially resulting in organ failure and death. But this phenomenon is not unique to COVID-19. It sometimes occurs in severe influenza, too, end quote. What the new study shows is that, quoting again, in live mice and human cells, infection with an influenza A virus, one of 2 types that typically cause seasonal flu, sets off a chain of cellular events or a pathway that boosts the metabolism of glucose. This action, in turn, triggers the production of an avalanche of cytokines, and blocking a key enzyme involved in the glucose pathway could be one of the ways to prevent a deadly cytokine storm, end quote. coronavirus was not included in this particular study, but the team behind it says that the same mechanism is likely engaged in COVID-19, and therefore these findings could shed some light on one of the deadlier outcomes for the virus. The study confirms findings from similar studies in 2018 and 2019 by other research groups and has been praised by fellow scientists for detailing the process of the phenomenon on a molecular level and showing how interfering with it could prevent the cytokine storm. However, interfering with the glucose metabolism could cause collateral damage. Co-author of the study, Menji Liu, said, quote, "It needs to be said that energy metabolism is essential for our immune cells to fight a virus. It may be important to combine antiviral treatment and metabolic inhibitors, suppressing the virus and reducing the overshooting immune reaction at the same time," end quote. Given the role of glucose and the knowledge that individuals with diabetes are at a higher risk of dying from COVID-19, it begs the question if diet could help prevent a cytokine storm. But Hatyo Wen, now an assistant professor of immunology at Ohio State University who conducted one of the similar studies in 2018, says, quote, "At this moment, I think it's too early to make a judgment about whether a special diet can fight against virus infection," end quote. Continuing from Scientific American, quote, "What scientists do know is that people with type 2 diabetes are more susceptible to severe flu infections. But that risk is not because they have higher glucose levels in their blood. The real reason," Wen says, "is that they cannot use glucose effectively and thus cannot initiate a proper antiviral response," end quote. While this could mean good news for preventing cytokine storms in COVID-19, the flu, and other viral infections in the future, the team behind the study, who have not yet conducted studies on actual humans, says that clinical use is quite a ways off. If you're a business of any kind, you need to correspond with your partners, with customers, with your team. Virtual work is one thing, but you still need to deliver physical documents. And if you're a business shipping product to customers, well, virtual can only take you so far. That's why I think in the current business environment, any business needs Stamps.com just to keep operations running. Anything you can do at the post office, you can do with Stamps.com. And yet, you don't actually have to go outside and physically go to the post office. With Stamps.com, you simply use your computer to print any official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send. Once your mail is ready, just leave it for your mail carrier, schedule a free pickup, or drop it in a mailbox. No human contact required. Plus, you can actually save money with Stamps.com discounts you can't even get at the post office. 5 cents off of every first-class stamp and up to 40% off USPS shipping rates. And now, Stamps.com even offers UPS services with discount rates up to 62%. Listeners to the show can get a special offer that includes a 4-week trial of Stamps.com plus free postage plus a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com, enter briefing. Stay safe, my friends. Beachbody On Demand is how you can stay in shape while you're stuck at home. Beachbody is the company behind P90X, Insanity, and the 21-Day Fix. You can get motivated by celebrity super trainers you know, like Tony Horton, Joel Freeman, Jericho McMatthews, and Autumn Calabrese. They have the best programs, hundreds of effective workouts for all fitness levels, ranging from bodybuilding to weight training to cardio hit to yoga and even dance workouts, all streaming to whatever device you want. View on your computer, web-enabled TV, tablet, smartphone, Roku, Apple TV, Chromecast, and more. And again, they don't require any extra equipment. Just some room in your house, a device to stream, say, Morning Meltdown 100 every morning to start your day. Some of the workouts are as short as 10 minutes. In the time it takes you to drive and park at the gym, you could be finished working out. Right now, listeners to this podcast can get a special free trial membership when you text briefing to 303030. You will get free access to this entire platform for free. All the workouts, nutrition information, even support totally free. Again, just text briefing, BRIEFING to 303030. A new study suggests that patients with certain types of cancer are nearly 3 times more likely to die of COVID-19 compared to patients without cancer. The study took place across 14 hospitals in China and involved 105 cancer patients and 536 non-cancer patients of the same age group, all of whom had COVID-19. Quoting from the Washington Post, the co-authors from China, Singapore, and the United States found that cancer patients who developed COVID-19 had nearly a threefold higher death rate from the virus than the 2 to 3% rate estimated for the general population. Cancer patients also were more likely to experience severe events such as being admitted to intensive care units and needing mechanical ventilation than people without cancer. Risk factors included not just age, but also the kind of cancer, the stage, and the treatment. These findings suggest that patients with cancer are a much more vulnerable population in the current COVID-19 outbreak, the authors concluded. Cancer patients are more vulnerable for several reasons, according to the paper's authors and other experts. For example, cancer itself depresses the immune system, and cancer patients tend to be older, which is itself a risk factor for serious complications from COVID-19. Blood cancers such as leukemia, lymphoma, and myeloma attack the immune system, reducing patients' natural defenses and making them prone to dangerous infections. Another high-risk group, patients with lung cancer, are more likely vulnerable because of reduced lung function, the authors of the study said. In addition, some treatments such as chemotherapy and surgery also suppress immune systems. The paper found that even cancer patients who had completed treatment had higher risks of serious COVID-19 complications than those who had never had cancer. But those with early-stage disease, for example, localized malignancies, had results similar to those of non-cancer patients, end quote. This news comes as cancer patients are already trying to navigate a healthcare system radically altered by COVID-19. Howard Burris, Chief Medical Officer and Executive Director of the Sarah Cannon Research Institute in Nashville and President of the American Society of Clinical Oncology, told the Post that some treatments have been delayed, with some hospitals effectively deeming all cancer surgeries elective, while other problems include shortages of critical pain medications and the closing of many clinical trials to new patients. Finally today, maybe file this under things we maybe should have had long before this, things I thought we probably already had. But regardless, if this is true, file it under if we finally have it now. Hey, super! News of a potential game changer for mass transit and other high-density environments, and frankly, for any environments out in the public, full stop. A team of researchers at the Hong Kong University of Science and Technology have developed an antimicrobial coating that can be sprayed onto surfaces and offers protection that lasts up to 90 days. Quoting Reuters, the coating, named MAP1, took 10 years to develop and is now available for commercial purchase. It's designed to be sprayed onto surfaces frequently touched by the public, like handrails and elevator buttons, replacing disinfectants with a shorter effective duration like diluted bleach or alcohol. HKUST adjunct professor and chief researcher on the team that developed the spray, Joseph Kwan, told Reuters, quote, "These places are frequently touched and at the same time serve as a very effective medium for transmission of diseases," end quote. According to the university, MAP1 can inactivate up to 99.9% of highly infectious viruses such as measles, mumps, and rubella, and 99.99% of the surrogate feline calicivirus, or FCV, a gold standard for disinfection efficiency. FCV is more resistant than coronaviruses, such as the one responsible for the COVID-19 epidemic, so the team is optimistic that the coating can inactivate the new coronavirus. Kwan said that MAP1 is further boosted by heat-sensitive polymers that release disinfectants upon human contact. The researchers say that the coating is non-toxic and safe for both skin and the environment. After passing clinical tests earlier this year, the coating has been applied by shopping malls, schools, and sports training facilities in Hong Kong. A local charity has also sprayed it in the homes of more than 1,000 low-income families in the city. Germagic, a unit of the university's industrial partner Chalupa Industries Limited, will sell MAP1 commercially, and a bottle for domestic use is expected to cost $9 for 50 milliliters. There is no word yet on U.S. availability. As always, this podcast was produced by Ride Home Media, the daily news podcast company. I've been Brian McCullough. The show was written by myself, James Welsh, and Jackson Bird. Be back with you again tomorrow. Be well.